Have you ever wondered if the medication you're taking could be affecting your lungs? It's a thought that often doesn't cross our minds, but some medications, while crucial for treating various health conditions, can actually lead to breathing problems. From shortness of breath to more severe lung issues, the side effects of certain drugs can be a serious concern. In this video, we'll explore 10 medications that have been linked to lung damage, helping you stay informed and proactive about your health. Understanding the potential risks associated with your medications is vital. This video will walk you through each drug's specific risks and what symptoms to watch for. If you're on any of these medications or considering them, this information could be a game changer in how you manage your health and communicate with your healthcare provider. Number 1. Macrobid, nitrofurantoin. Macrobid is a commonly prescribed antibiotic for urinary tract infections or UTIs. But it comes with a caveat. Although lung-related side effects are rare, they do occur in about 1% of people taking this medication. Some individuals might experience short-term or even long-term lung problems, which can range from mild discomfort to more serious issues. If you recently started taking Macrobid and notice any unusual symptoms like persistent cough or shortness of breath, it's important to let your healthcare provider know. They might adjust your dosage or switch you to a different medication to ensure your lungs stay healthy. Number 2. Amiodarone. Amiodarone is a lifesaver for many dealing with abnormal heart rhythms such as atrial fibrillation. However, it's also one of the heart medications most commonly associated with lung problems, including a serious condition called drug-induced interstitial lung disease or DIILD. In about 2% of cases, users might experience significant lung issues, especially if they're on doses of 400 milligrams or less. Regular monitoring is crucial for those on amiodarone. If lung problems are detected early, stopping the medication often leads to recovery. Your doctor might also prescribe steroids to help with inflammation. Keeping up with regular checkups can make a big difference in catching any potential issues early. Number 3. NSAIDs, aspirin, and others. NSAIDs, like aspirin, are frequently used to alleviate pain and inflammation, but they aren't without their risks. In some rare cases, NSAIDs can trigger a condition known as aspirin-exacerbated respiratory disease, or AERD. This can be particularly problematic for people with asthma or chronic sinus issues, where AERD affects between 10% and 40% of individuals. If you find yourself struggling with asthma symptoms or sinus congestions after taking NSAIDs, it's worth having a chat with your healthcare provider. They might suggest alternative pain relief options that won't impact your respiratory health. Number 4. Beta blockers. Beta blockers are essential for managing blood pressure and various heart conditions, but they can sometimes cause unexpected side effects in people with pre-existing respiratory conditions. Non-selective beta blockers like propranolol and carvedilol can cause wheezing or bronchospasm in individuals with asthma or COPD due to their impact on lung receptors. If you're experiencing worsening asthma or breathing issues while on a beta blocker, consider discussing this with your doctor. They might recommend switching to a cardioselective beta blocker, which is less likely to affect your lungs. Number 5. Methotrexate. Methotrexate is a cornerstone treatment for autoimmune conditions like rheumatoid arthritis and psoriasis. However, it's not without its downsides. This medication can cause lung problems, and sometimes it's challenging to determine whether the issue is due to the drug itself or the underlying condition it's meant to treat. If you're on methotrexate and notice any new or worsening breathing issues, make sure to consult your healthcare provider. They might adjust your treatment plan to manage both the medication's side effects and your underlying condition more effectively. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Leflunomide. Similar to methotrexate, leflunomide is used to treat rheumatoid arthritis, particularly in patients who don't tolerate methotrexate well. Although less commonly used, leflunomide can still exacerbate pre-existing lung disease or cause new lung problems in a small percentage of users. If you're taking leflunomide and have a history of lung issues, keep an eye on your respiratory health. Regular check-ins with your healthcare provider can help manage any potential side effects and ensure your lungs remain in good shape. Number 7. Bleomycin. Bleomycin is a powerful chemotherapy drug used to treat cancers like lymphoma and testicular cancer. Unfortunately, it comes with a notable risk of lung damage, particularly in people with poor kidney function. The risk of developing drug-induced interstitial lung disease or DIILG is significant, especially within the first 8 months of treatment. If you're undergoing treatment with bleomycin, staying vigilant about any lung-related symptoms is crucial. Regular monitoring can help detect and address issues early, minimizing long-term damage. Number 8. Gemcitabine. Another chemotherapy drug, gemcitabine, is used to treat cancers such as pancreatic and breast cancer. While it's effective, it also carries a risk of DIILD, with lung problems sometimes appearing unpredictably. Research suggests that the risk is higher in patients receiving gemcitabine for lung cancer and in those over 80 years old. If you're on gemcitabine, particularly for lung cancer, be proactive about reporting any breathing difficulties to your healthcare provider. They can help manage the side effects and adjust your treatment as necessary. Number 9. Busulfan. Busulfan is used in the treatment of leukemia and as part of a pre-transplant conditioning. However, it's associated with a risk of DIILD affecting up to 8% of users. Symptoms of lung damage typically begin within the first year of treatment. Monitoring for symptoms and discussing any concerns with their healthcare provider is key. They can help manage any potential side effects and adjust your treatment plan to safeguard your lung health. Number 10. Other chemotherapy medications. Several other chemotherapy drugs, including epidermal growth factor receptor or EGFR inhibitors and mTOR inhibitors, are known to cause lung damage. These medications, used to treat various cancers, can lead to DIILD and other lung issues. If you're being treated with these drugs, it's important to stay informed about the potential lung risks. Regular communications with your healthcare team can help you manage these risks effectively and ensure that your treatment plan is optimized for your overall health. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!